And I think this is, we're going to be taking our last question for tonight. Uh, Today morning for you. I'm sorry. So the question is, my father has been experiencing shortness of breath that's getting worse over time, and he has a dry cough that won't go away. His doctor mentioned something about lung scarring. Could this be pulmonary fibrosis? Is it treatable?
That's a very good question. Of all the diseases that pulmonologists face, we hate pulmonary fibrosis. The reason is we don't have a lot of therapies to offer. And in response to this person's question, yes, it is possible that this could be pulmonary fibrosis. What is pulmonary fibrosis? So I'm going to use another analogy here. I'm sure everybody's sick of my analogies by now. In your lung, which is like one big balloon, there are multiple tiny balloons, and they are called alveoli. And these alveoli are organized into secondary lobules, which is kind of like a room with full of balloons. Just like a room in a house, you have walls, right? Walls which keep the rooms attached together and keep the whole house stand. Just like that, our lung has tissue in between these secondary lobules and in between the alveoli. We call that the interstitium. It contains some fibrous tissue, some blood vessels going through there, lymphatics. That is the interstitium. When you have any form of chronic inflammation, let's say from somebody who is working in a mine, he's getting exposed to coal dust. So let's say somebody is working in a rock mining facility where they're breaking down rocks into smaller ones so that we can use that to put flooring, right? Or sandblasting. These people inhale tiny particles which are inorganic, which can cause you to have inflammation and irritation, but your body cannot get rid of those particles. And that can lead to scarring over time. We call those pneumoconiosis or occupational exposure related lung diseases, which can lead to scarring. I don't know what this patient's father's history is, but these are patients who sometimes we can point to the cause, like I said, mines or exposures. Sometimes we don't have a clear cause. We call those idiopathic interstitial pneumonias. What does that mean? Idiopathic means we don't know the reason. Interstitial means it affects the part in the lung which is holding up the secondary lobules, the interstitium. And what does it do? It causes something that looks like a pneumonia, feels like a pneumonia, and it comes on over time. So, of all the interstitial idiopathic pneumonias, the most common one or the most well studied one is something called idiopathic pulmonary fibrosis or IPF. It is characterized by having scarring, which is more in the lower parts of the lung. It gets worse over time. There are some medicines which can slow down the progression. We call those antifibrotics. There are two different antifibrotics on the market right now. There is third one, which is undergoing phase 3, which has undergone phase 3 trials and is being under consideration by FDA for approval for the last 6 months. So those are pirfenidone. It's the drug name. I don't know the trade name in India. And the other one is nintedanib or OFEV. This was also trialed in COVID, but these two drugs have been shown to slow down the progression in the scarring, which means they can preserve lung function to a degree, but they are, number one, quite expensive. Number two, we don't know for sure how effective they are in keeping people alive, or they don't really also reduce the functional status improvements. So pulmonary fibrosis is definitely possible in this patient, especially if a general physician saw an X-ray and saw some scarring. Depending upon what type it is, we don't know whether it is going to progress or not. Again, the most common type is called idiopathic pulmonary fibrosis, IPF. And this tends to progress over time. And unless they are on active treatment, there is a mortality rate of up to 55% in the first 5 years of diagnosis. Once you get diagnosed, which usually happens when they're 60, 70 years of age, only half the people are alive 5 years from the diagnosis time. The reason is the lung disease progresses, and also they are more prone to developing infections, and those infections, if they have a pneumonia on top of the scarring, it's most likely that they are not going to survive. So it's a very scary disease, it's a very bad disease, and as a pulmonologist, it's the one disease that I'm worried about whenever I see a patient with it, and I worry about those patients as soon as I see them. Does that make sense?
Mm-hmm. Yes, and going back to when you said that it presents as like interstitial pneumonia, is it like a narrow differential? How do you like diagnose it as fibrosis if it's presenting as pneumonia?
So fibrosis just means scarring of the lung, and a high resolution CAT scan, a high resolution CT scan is the best tool we have to diagnose what type of fibrosis they have. And sometimes you need to get a very detailed history. And a lot of these patients have an associated connective tissue disease like rheumatoid arthritis or scleroderma, which are a whole different thing to talk about. I won't get into details about that. But if you have any of those tests, if you have any of those diseases, you're more prone to developing scarring. And the first question we ask ourselves whenever we see a patient with pulmonary fibrosis is this going to get worse? Or is this related to exposure they had in the past and they're not having that exposure now, so it's going to be stable? Or is it steroid responsive? Some people respond beautifully to steroids. So these are the questions we ask ourselves. And the first step universally is to get a high resolution CT scan.
Mm-hmm. And have you found that a lot of your patients respond well to steroids for the
Not
fibrosis?
not everybody with pulmonary fibrosis responds. And again, pulmonary fibrosis is not a disease by itself. Idiopathic pulmonary fibrosis is a disease, but the nomenclature is quite confusing. Pulmonary fibrosis just means scarring of the lung. It can be seen in all interstitial lung diseases. Some of the interstitial lung diseases, especially hypersensitivity pneumonitis or eosinophilic pneumonitis or lymphoid pneumonitis, these respond beautifully to steroids. They respond very, very well to steroids. Some do not respond to steroids. Once you develop a lot more scarring and inflammation that is progressing towards scarring is not very prominent, there is not a lot of steroid responsiveness you see. Once you have scarring, you have scarring.
Thank you so much, Doctor. And I think that brings us to the end of today's session. I know we went into like a lot of complex topics. Thank you for simplifying it, breaking it down. And I think I personally enjoyed your analogies so much. Like they were so on point. Thank you so much. And to everybody that's listening right now, if you enjoyed this session, please do share it with your family and your friends. And if you want to consult with Dr. Kakkera or any other doctors on our, please connect with us on our website, My American Doctor, or contact us on 9914941494. Thank you so much, Doctor. Thank you for taking the time.
It's my pleasure. Thank you for having me.
Thank you. Have a nice day. Bye. Thank you.
Bye.